We're now going to move into our quadruped position, spreading hands nice and wide, grounding palms, tucking the toes in the back. And we're going to do a little bit of foot mobility, and then we're going to get into some spinal waves and then some tall kneel lean backs. So I want to really get those toes tucked underneath as much as possible. Inhale, we're going to rock forward. Exhale, I want to feel the weight of our hips sink to our heels so that we can feel that nice load stretch into the balls of the foot and into the arches of the feet. Inhale as we come forward. Exhale as we very slowly let those hips sink, squeezing into it. Inhale as we come forward. As we're sinking into it, I want to continue to feel that weight. I want to see how much can we start to feel the weight of our hips to our heels. Can we start to come up into a kneel, a deep kneel sit with the toes tucked in? Inhale, we come all the way forward. We can use this as an assessment point for the feet as well as the knees. If your feet are too painful, do not push into this position. Only going back as far as we comfortably can, not getting into pain. If you're able to sit back at the feet, but you're finding that the knees are stiff and not allowing that hip to come down, that would be an indication of some inflammation and swelling in the knees. Now we're going to go ahead and untuck the toes, and we're going to do a lot of the same stuff. So nice exhale as we reach those hips back to the heels. Inhale as we come back forward. And as we're doing this one, I'm now continuing to pay attention to that, to the knee space as well as the front of the ankles. Does one ankle want to sit off the floor? Is there space? Maybe both ankles want to stay off the floor. Do you feel a lot of tightness and tension through the front of the ankle space? If so, then this is a movement I might want to groove in a little bit more. Can we get that space in the front of the ankles to open up a little bit over time? If you're able to get hips to the heels, can you start to sit back and rest hips on the heels in that deep kneel sit without discomfort in the knees? If we're able to go through all of this without pain, then we can now bring this up into a tall kneel. And this is where we're going to get into some of our pelvic scoops. Coming back into our crocodile breath, breathing into that crocodile, exhale, drawing the navel into the spine. As we breathe into that belly, I want to let the pelvis tilt forward. Belly opens up, big sway in the back. Exhale, we're drawing that navel up and in as we scoop so that we feel that light, maybe a light stretch in the front of the hips, but more importantly, we start to feel some contraction in the glutes. Inhale, opens it up. Notice how as we inhale, belly opens up, that rib is sticking out. As we exhale and scoop, rib is drawing down. Core should be kind of getting tight and engaged. I want to really start to feel that scoop and engaged core. If you're able to get that, again, I'm going to need to make sure we are not in pain, no pain in the knees or in the back. As we get that scoop and we lock in that core, feeling that core engagement, we can bring our hands across chest and start to lightly lean back. Now, inhale, coming forward, opening it up, exhale, scoop, and then a nice slow lean. Now, as I lean back, I don't want to lose my pelvis or my rib. I don't want to reach back from the shoulders where I get this big arch in my back. I want to maintain scoop and engagement. So I'm really more forward with my head and my shoulders as I'm rocking back. I don't want those head and shoulders to be to lead the way. I want them to be behind. I'm really leading the way with my core. Once we get about 5 or so with the toes untucked, we're going to go ahead and tuck the toes. We're going to do that, start with that same pelvic tilt. Inhale, let the belly go forward, pelvis goes forward. exhale, actively scoop. Get 3 or 5 breaths. Feel that locked in front of the hips, glute engagement, and core activation. Once you feel all those things, as you exhale and scoop, let those hands cross and start to lightly lean back. Inhale as we come forward, opening it up. Exhale as we scoop and lean back. Again, only lean back as far as you can, maintaining that core engagement and not getting that arch in the back. Good. We'll go ahead and come down to the floor.